My name is Ryan Robertson with OrthoVirginia, and welcome to our Facebook Live. For those of you who don't know about OrthoVirginia, we are the largest multi-special orthopedic practice in Virginia. We have offices in Richmond, which is where I practice, Northern Virginia, Lynchburg, Southwest Virginia, and Virginia Beach. I don't want to take up any time talking about our practice, but if you'd like more information about OrthoVirginia, please visit our website at www.orthovirginia.com. Now let's talk about a topic and procedure I love, partial knee replacements. My goals for this is to explain that obviously there's more than just one compartment to the knee. There's both a medial, lateral, and patellofemoral joint. Inside of that, any of those three can be replaced, and as long as you have arthritis in one of those compartments, to explain the benefits of the smaller surgery while also discussing some of the risks that are associated with it, and then obviously dispel the concern about the longevity of a partial knee replacement being inferior to a total knee replacement. Today, we'll talk about obviously just knee pain, what causes knee pain. We'll talk about some of the aspects about arthritis that contribute to knee pain, which then obviously can go on to needing treatment. We'll talk about some of those treatments that are from the conservative side, covering non-operative treatment, and then go on to talk about the surgical treatments, specifically talking about partial knee replacements versus total knee replacements. I'll also hit on some of the surgical pearls of the procedure to give you better understanding about the procedure, and then talk about some of the recovery from it as well as the longevity. And then most importantly, at the end, we'll open it up for question and answers to try to address all the questions that you all have on this topic. But before I jump into the topic, I don't want you to forget about your friends and family. If you have anyone else who you think would possibly be interested in this topic, please take a minute and share this live event. Just click on the share button at the below on your image, and otherwise we'll get started. So talking about knee pain. Obviously most people think about knee pain and immediately jump to knee arthritis or things inside their knee pain, but obviously always want to think about the other things that could be causing knee pain. That could be things referred from your hip or your back. That also can be the tissues outside of the knee joint itself. And so obviously seeing somebody getting a diagnosis that actually pertains to in the knee joint itself, arthritis or some other pathology, allows for going down this route that would lead to a partial knee replacement. Obviously, as we said, there are multiple parts to the knee. So there's not just one knee joint. There's actually sort of three individual compartments to the knee. There's the medial, the lateral, and the patellofemoral. So that makes up the inside, outside, and underneath the kneecap in the knee. And any of those can develop arthritis and can eventually need surgery, which can either be addressed with one surgery, addressing all of them in a total knee replacement, or as in we're talking about today, can be addressed individually as a partial knee replacement. The most common cause for knee pain is arthritis. There's 91 million Americans that are affected with arthritis in their knee, 31 million of those being osteoarthritis, which is the most common cause of arthritis, which also is the most common cause for having to have surgery or having a partial or total knee replacement. Overall, we're about a 45% risk of having symptomatic knee arthritis at some point in our life that may require surgical intervention. People ask, well, what is osteoarthritis? Osteoarthritis is the breakdown of the cartilage in your knee, which is the shock absorber between your bones. As you start to have that wear away, you start to get more stress in your knee. As you get more stress in your knee, you start to have changes in your knee. It can get thickened, it can get hardened, you get little bumps on it, which we call osteophytes, and that all contributes to the pain that you feel in your knee. Common question that follows that is, well, what causes arthritis? Why did I get this? And it's a multifactorial disease, somewhat related to overuse and trauma, somewhat related to abnormal biology or abnormal anatomy. And unfortunately for some people, it's also a genetic aspect. So common symptoms that come along with arthritis or knee pain: joint pain, joint stiffness, swelling, and even those bony prominences we talked about, which are results of those osteophytes. You can have cracking and grinding with movement in the knee. And then eventually, if it gets bad enough, you can have decreased range of motion or even malalignment of your joint. So how do you deal with knee arthritis? Well, obviously, the point of this talk today is to talk about partial knee replacements, but I'd be remiss if we didn't talk about the non-operative things, the things you can do before having to come in to see somebody like myself. So activity modification, avoiding certain activities and things that you do throughout the day that can cause pain when you do them. Sometimes giving up certain activities allows you to do other activities throughout your day and throughout your life that allows for quality of life. Otherwise, you can talk about medicines. There's both oral and topical medicines you can apply or take that can help with your pain. Weight loss and strengthening takes some of the stress off your knee. Using bracing in your knee can help with your knee pain. And then there are injections you can get into your knee, both gel injections, steroid injections, as well as biologics with PRP or stem cells that can help with your knee pain. After all of those things have been exhausted and you can't keep going on with your current quality of life, then we start talking about surgical options. There's some older options with osteotomies where we cut the bone and we realign the bone, but those are falling out of favor because we're having better and better success rates with these arthroplasty procedures, whether it be a partial replacement or it be a total replacement. Overall, the most common thing people think about when they hear about arthritis and knee pain and replacement is a total knee replacement. It's one of the most successful surgeries that's out there because of the debilitating nature of arthritis for our aging population. It's become very popular. Well, on the other side of that, we're also having younger and younger patients who are being crippled and having debilitating pain from arthritis. So we're doing more and more patients. So it is very popular and common. However, partial knee replacements are a great option for the right patients. At the moment, it's only about 8% of the total replacements done for patients, whereas it could be probably as high as 47%. So there are probably patients out there getting a total knee replacement that could just have a partial knee replacement, and that could give them certain benefits. Benefits of a partial knee replacement: it's a little bit of a quicker recovery. It's less that's dissected, less surgery, less involved in the knee. So you get over it a little bit quicker. Along with that, you have a little bit less pain after surgery. Because we're only operating on a portion of your body, you have less blood loss. And then only because we're replacing a certain part of your knee, the rest of the knee remains normal and feels more like a normal knee. Overall, with a total knee replacement, only about a third of knee replacements are the forgotten knee or feel like a normal knee. There's a much higher rate of that being the case when you have a partial knee replacement. Usually your preoperative range of motion is somewhat better and you're at a greater risk or greater success of preserving that range of motion after surgery with a partial knee replacement. And overall, the patient satisfactions of a partial knee replacement actually do slightly surpass a total knee replacement. And they've been shown to be a smaller risk for complications with partial knee replacement. Now, there still are risks and complication, but slightly less than if a total knee replacement. And that makes sense because we're doing a smaller surgery, less involved, so you're having less things that can go wrong. The disadvantages: it is slightly less predictable about pain relief, because if it is that you're having pain from the other parts of your knee and we only address one part of your knee, you may still have some residual pain in those other areas of the knee, as well as the inability to completely change alignment. So if you're a little bit of alignment deformity in your joint is a big concern of yours, a partial knee replacement may not be the right surgery for you. As well as if you have a very stiff knee, a partial knee replacement may not be the right surgery for you and may have to do a total knee replacement because there is more cutting, there is more relief of tissues that can result in a greater range of motion post-operatively than what you have preoperatively. And obviously the biggest knock on a partial knee replacement is the possibility of a needed surgery in the future, converting a partial knee replacement into a total knee replacement. So then the follow-up question: well, who's a good candidate for a partial knee replacement? And my actual answer would be is most people who are a good candidate for a total knee replacement also would be those who are a good candidate for a partial knee replacement. The first thing being, you need to have advanced arthritis and you need to have pain that no longer is adequately controlled by conservative measures. If you can control your pain with conservative measures, then I would tell you you don't need to have a surgery at all. You should continue to manage it conservatively until your quality of life is impacted enough by your arthritis that you need to have surgery. Then the things that are different from a total knee replacement is your arthritis does need to be limited to 1 or 2 compartments inside your knee. And then there are some people who are not indicated for it, people who've had ligament damage that creates instability in the knee, or an inflammatory arthritis that you may have ligamentous injury or higher risk of the implants loosening if you did a partial knee replacement. And then, as we said, those patients who have significant stiffness in their knee or have a large deformity, those are not candidates. Previously, this was believed to be a surgery of the elderly, And if you were young, there was concern that you would wear it out, or that you would have further progression of the other compartments. That has since gone away, and more younger patients are getting this surgery. Also, it used to be that if you had an ACL reconstruction, you were considered not a candidate for it. But more and more people are having this surgery after having an ACL reconstruction, or even having it done at the same time as a ACL reconstruction. Or some patients who are deficient in their ACL are still having the surgery done and having very good results from it. The other thing that previously was a contraindication for it was weight. There are patients who are now having the surgery with higher and higher BMIs that are also having successful surgeries without major complications. So that by itself is also not a contraindication anymore. So talking a little bit about the procedure. So these are a couple models that we have here to illustrate some of the differences. I'll try to bring them into view a little bit easier for people. So this is a partial knee replacement on just the inside of the knee, so what would be called the medial side of the knee. When we go in to do the surgery, we make a cut in the knee, we remove the kneecap out of the way to look into the knee. We then inspect all the parts of the knee to look to make sure and confirm that the arthritis is just in that one portion that we're planning on replacing. Then once we've confirmed that, we then protect all the other ligaments in the knee, as well as the other portions of the knee that we're not planning on resecting. We then remove bone from the knee, removing bone from the shin bone, making a nice little area to allow for placement of a metal plate and a plastic liner that goes into the inside of the knee. We then remove bone from the end of the thigh bone, where all that arthritis and cartilage has been damaged and removed. And then we implant a little metal cap over the end of the thigh bone. That then allows for movement of the knee. You do have a little click clack from where the metal and plastic hit, but the goal is to give it enough of a laxity that allows for good motion after the surgery. The portion about the alignment correction question, we try to actually leave the leg partially undercorrected. So in a knee where you're having surgery on the inside, we leave your leg a little bit more bow-legged, so the pressure keeps going through the inside of your knee. And then we actually protect that outside cartilage that was otherwise not replaced by not overloading and putting too much pressure through that. Along with that, you can obviously have a partial knee replacement of just underneath the kneecap. And so in that case, we go in and remove bone from just underneath that kneecap and put a metal piece of replacement right on the thigh bone. And then on the back side of the kneecap, we put a little plastic cap that then will articulate the plastic on this metal here. In certain situations, we can do it where we do both a partial replacement underneath the kneecap and on the thigh bone, as well as on the inside of the knee to replace both the inside of the knee and underneath the kneecap. This is all contrary to a total knee replacement, where we go in and remove both the bone from the end of the thigh bone. So we remove the whole entire end of the thigh bone, and we remove the whole top of the shin bone, putting in a metal plate that is larger and wider than the partial knee replacement. And then again, putting a metal cap, but instead of just on the inside of the knee, we're putting it over the whole entire knee. Obviously, just thinking about that, that's a much bigger surgery. It means we have to expose the whole knee, and we're cutting more bone, which is a larger generator for both bleeding as well as for pain fibers, as well as requires stripping and alignment modifications for the soft tissues. So there's more dissection with the knee, so it can cause more pain. So the next sort of portion is after surgery. So after surgery, the recovery takes between 4 to 6 weeks usually, but you still recover and get better for up to about a year. That doesn't mean that you're incapacitated for that 4 to 6 weeks. You're up walking. Most people are off their walker or forearm crutches by 2 weeks. Just working on that motion, working on that strengthening, getting back to activity. Driving, which is a common question. You can do that from my standpoint similarly as a knee replacement. As soon as you're off narcotics and you can slam your knee down, that's your driving leg. Now, sometimes that's your non-operative leg, but if it's your operative leg, that can take anywhere from 2 to 6 weeks. I do restrict your activities for about 3 months from doing heavy lifting, significant bending and twisting activities, just to allow your body to remodel and to strengthen around that partial knee replacement. Otherwise, gradual advancement back to activities, and eventually you can do any activity you want to try. I don't have any limitations for the rest of your life from it, but there will be certain activities that just don't feel comfortable. Sometimes kneeling doesn't feel comfortable. Sometimes, high impact running and explosive sports don't feel comfortable, but you're okay to try to do those things. So how long will this partial knee replacement last? Well, the common misconception is that it's a stopgap for a total knee replacement. And that's how it used to get sold. It used to get sold as this will last you 5 to 10 years and delay you having to have your total knee replacement. That is not the case nowadays. In the right hands and in the right patients, these surgeries can last 20 to 25 years with good results. There's overall about a 90% longevity at 20 years. So that means even at 25, 30 years, there are still partial knee replacements that are doing perfectly fine and will never need to have a conversion to a total knee replacement. Otherwise, that's the majority of what I specifically wanted to talk about in regards to partial knee replacements. Otherwise, we'll open it up to some of the questions that have come in that my staff will forward on to me. And we'll try to get the rest of your guys' questions regarding partial knee replacements and knee pain and knee arthritis addressed for you today.
Thank you so much, Dr. Robertson. We have lots of questions coming in. So somebody asked, how long before I can go up a staircase?
So that's a great question. So this is actually an outpatient surgery. So patients go home the same day from the surgery. And before you leave our surgery center or our hospital, you have to be able to do stairs before you can leave. So the common then second question is, okay, fine, I can do a couple stairs to get in and out of my house, but can I go up to my second story bedroom? That is perfectly fine. I usually just encourage people, plan to go up once a day, come down once a day, just to make it easier on yourself. But the honest answer is every time you're going up and down the stairs, it's a little bit of rehab. It's a little bit of working on that strengthening, and is perfectly fine and safe for you to do right after surgery.
Thank you. How do you diagnose whether a replacement is needed?
Yeah. So there is a combination of both physical exam as well as history, as well as x-rays that comes into that decision making. So obviously it's really easy for me when a patient comes in and they say with one finger, this is where it hurts, and it only hurts on the inside or the outside of their knee, or they point right to their kneecap. And then that is corroborated by their x-rays. So their x-rays agree that yes, there's only full-on narrowing on the inside of the knee or the outside of the knee or just underneath the kneecap. And then sometimes we then sort of come in between those things. So they have a little bit of some arthritis in some of the other parts, but they have no symptoms on their exam or on their history. So we say, yep, good for just a partial knee replacement. It's those patients who have x-rays that show bone-on-bone arthritis in more than one compartment to the point where they say, you know what, I don't want to do 2 partials. I'd rather just do a total knee replacement, or they have some of those other limitations that would preclude them from being a great candidate for a partial knee replacement, whether it be the severe arthritis that's leading to a deformity in the knee or a big restriction in their motion that would preclude them from it. But otherwise, if you meet those other criteria, you're a great candidate for a partial knee replacement.
Thank you. Is over 80 years old too old for a partial knee replacement?
So a common question in general in joint replacements is there a cutoff for age? And I would tell you there is not a cutoff by a chronologic age. It more comes down to your physical fitness and your medical fitness. If you are medically fit and physically fit to undergo a surgery, then you can be a great candidate for a partial knee replacement. And sometimes a partial knee replacement is a much better answer in that age population because it is a smaller surgery. It is an easier recovery. It puts less of a physiologic demand and burden on the patient for recovery and can be very successfully accomplished in that patient population. They actually have done some recent studies looking at that, and they actually showed a lower incidence of complication looking at some of the Medicare data in the 80 plus population when having a partial knee replacement. So it can be done very successfully and is a great option.
How long does each surgery take?
Another great question. So a partial knee replacement can go anywhere from about 45 minutes to an hour, up to about an hour and a half to 2 hours, just depending on needing for rebalancing, debridement, other things that go along with the surgery. A total knee replacement takes more around an hour to 2.5 hours, depending on elaborateness of a knee replacement and other aspects involved in that.
Thank you. Is rehab done at a rehab facility? When does rehab start?
Yeah. So obviously this is dependent on each surgeon and each practice's decision making in this. In my own practice, I've pretty much exclusively gone to the rehabilitation happening either on their own self-directed or on an outpatient basis with an outpatient physical therapy group, whether that be one that works with our group in one of our offices, or whether that be one associated to a hospital or a standalone physical therapy location. But there are some patients who can even do the therapy on their own, just with some instruction, some either pre-rehabilitation visits with a therapist or with a online-based platform or some handouts provided by our group or another group. We rarely send patients after a partial or total knee replacement to rehabilitation anymore. These are outpatient surgeries. Even if there's a short stay in the hospital, you still recover at home in the environment that's familiar to you with your family and friends. That leads to a better outcome, higher satisfaction rate, better care, quicker recovery. Our goal is to get you back to your lifestyle, and there's no better place for that to happen than in your own home.
Thank you. Is the scar smaller in a partial knee replacement?
Sorry, Mark, say that one more time.
Is the scar smaller in a partial knee replacement?
So obviously the size of the scar is both surgeon dependent and patient dependent. As I tell patients, I do as large of an incision as is needed to do the surgery the right way. And if I need a larger incision to show more of the knee and to do more of the surgery, then you will get a larger incision. But yes, my partial knee incisions are smaller than my total knee incisions, just because I'm only exposing just enough to do the surgery on that one portion of the knee, versus if you think about it, I need to expose the whole knee. So I have to make a larger incision to expose the whole knee versus just one small portion of the knee.
Thank you. Do you ever start a surgery thinking it's going to be a partial replacement, but then you end up having to do a full replacement?
Yeah. So obviously, every doctor is different and every patient is different. And so I have a conversation with every one of my patients talking about partial and total knee replacements. And when I talk to you about a partial knee replacement, I usually ask, if we got in there and I saw more damage in the other parts of the knee, even though on physical exam, x-rays, and your history, it seems like you are a perfect candidate for a partial knee replacement, would you be okay with me doing a total knee replacement? And I usually have that as a backup option if needed. But there are some patients who say, Doc, you won me over on the quicker recovery, on the smaller surgery, all those points. That's what I want. If you thought that I was good enough, then just do the partial, and that's all I want. Because there are some data out there that even if you have arthritis in some of those other parts of the knee, that those can be ignored and you can still do just a partial knee replacement and have a equally successful outcome. Now, you may have a little bit of some aches and pains from time to time in some of those other parts of the knee, but the honest answer is, even if you have a total knee replacement, you can still have occasional aches and pains in your knee, because there still are soft tissues around the knee that can get inflamed. You can still have some irritation of the bone. Cold weather can affect those replaced portions of the knee as well. And so there are people out there who are more and more pushing doing partials and accepting some degree of arthritis in the other parts of the knee.
Thank you. If I'm scheduled for a total knee replacement with one leg, but my other leg has started hurting more, can I switch which leg I get operated on? And why can't I get them both done at the same time?
Yeah, so those are great questions as well. And unfortunately, for some portion of the patients we take care of, something they have to deal with where they're affected with both knees being affected with arthritis. Obviously, I usually say that you should replace the one that is symptomatic. So if one knee bothers you and the other does not, then you don't replace the one that's got arthritis but is non-symptomatic. So you would do and change plans if possible to the other side. Now, unfortunately, for some systems and some surgeons, it is not a type of thing where they can change the plan the day of the surgery or within inside a few days before the surgery, but some can. And that'd be something you'd have to discuss with your individual surgeon. The question about doing both knees at the same time. That's a separate thing. So some surgeons do both knees at the same time. I personally, in my practice, do not do both at the same time. Every doctor has their own beliefs in that. My concerns with that is they have done some studies looking at that. You're a little bit of a higher risk for complications, a little bit of higher risk for blood loss, enough to where you need to have a blood transfusion. Obviously, that makes sense. If you have 2 surgeries, you double the amount of bleeding, you double the amount of blood loss. So you're a little bit of a higher risk for needing to have a blood transfusion. If you're having 2 legs operated on, it's a little bit of a harder recovery because you don't have a quote unquote good leg to stand on. And so even though it may be an arthritic knee, it may be able to support you a little bit easier than right after having had a replaced knee replacement, whether it be a partial or a total. So I do like to have a good leg, quote unquote, to stand on. So what I will do with some patients is we will stagger them, whether it be 6 weeks, whether it be 12 weeks, so that your overall recovery is overlapped, but allows you enough time to both build up your blood stores back up, allows you to get some of the strength in your operative leg before we then do your other operative leg. But there are doctors out there who will do both sides. It just may mean a little bit of a harder recovery for you as a patient in that immediate post-op setting. You may have a harder recovery with some of with your family needing to help you out a little bit more. And so that can be the issue there.
Thank you. What percentage of partial knee replacements do you do compared to total knee replacements?
So I would always love to be doing more, but obviously there is a patient component to this of people choosing to go through with it. So I do, in my current practice location, have some patients who lean closer to a knee replacement in the setting of it being a toss-up between a partial or a total. And some patients still just prefer to have a total. And that's why we do these Facebook Lives and lectures to educate patients about the benefits of a partial knee replacement. And so right now, my practice is probably about 15% partial knee replacements, but would love to get that up to more of a 30 to 40% portion of my patient population.
Thank you. Is partial knee replacement good if you have kneecap arthritis, but no other arthritis in your knee?
So it is slightly a different recovering from a patellofemoral partial knee replacement versus a medial or lateral partial knee replacement. The reasoning for that is we're resurfacing the backside of your, basically what we call your extensor mechanism, which is what allows you to extend and hold your leg straight. And so it is a little bit of a harder recovery. Whereas I say that 4 to 6 week recovery for a partial knee replacement, that is more the recovery for a medial or a lateral partial knee replacement. The patellofemoral partial knee replacement does take longer, and that is more in the 3 to 4 month mark, but still recovering for up to about a year. And a lot of that is getting the strength back in your quad muscle. You have a little bit of a bigger hit to your strength in your quad muscle with a patellofemoral replacement. But I have some patients who have had very good success with, before that, you're having trouble going up and down the stairs, you're having trouble getting up from a seated position because it just puts so much pressure underneath that kneecap, and they have a very good result. It just takes a little bit of a longer recovery. And even if they have a little bit of some arthritis on the inside and outside of their knee, it does not nearly affect them enough to where that would have been enough of a reason to do a total, and they get great range of motion afterwards and are very happy with the outcome.
Thank you. Is it fair to say that the partial knee replacement is primarily for arthritis pain versus someone who has multiple ACL revisions?
So if you've had multiple ACL revisions, the possibility that you have isolated wear just to a single compartment does unfortunately start going down, because you a lot of times will have a multiple compartment post-traumatic arthritis that develops. And so, or you have wear that is not appropriate for a partial knee replacement. So your risk or your chances of being able to have a partial knee replacement do go down. It's not zero, but it is less likely that you would be a candidate for a partial knee replacement.
Thank you. Do you replace the knees of many people in their 40s?
So obviously, historically, this was a surgery of, elderly patients. It has become younger and younger. I would say that more and more patients are having this surgery done in their early 60s and 50s. 40s is less common, but it is done. And it is done when you have end-stage arthritis that, your quality of life is significantly impacted and you failed all the conservative measures. And we then, have to have a conversation about understanding the risks and benefits. Like I said, the surgery should hopefully last for 20 to 25 years. But if you're in your 40s, you're probably looking at a revision surgery in your 60s to 70s. That may be able to be just a conversion to a total knee replacement if it's a partial, or if it's a total, it may need to be revised completely, or it could be possibly revised just with the plastic liner being changed out. And so you understand that and accept that risk. There are patients that I do, their partial and total knee replacements in their 40s.
Thank you. How long after a partial knee replacement before you can ride a bicycle?
So you're actually able to start getting on a bike, in your rehabilitation in that first 6 weeks. How comfortable you are and how quickly you get to where you can go a full circle without significant discomfort, depends a little bit on your flexibility, depends on, how your recovery is coming overall. But everyone is different and unique. The patient who was out chopping wood 2 weeks after his partial knee replacement, he probably was ready to be on a bike at 2 weeks. The patient who still is needing to be around with a walker or forearm crutch or something like that at the 3 to 4 week, they're probably still, maybe a little bit of ways from being on a bike, being able to make that full rotation with their knee.
Thank you. Are partial knee replacements covered by Medicare?
So obviously, before any of our replacements, we do submit for approval from your insurance. And so, yes, they are covered by your insurance.
Thank you. How long can you have shots in your knee for the discomfort before it becomes necessary to have a replacement?
Yeah. So there's different thoughts on this. Obviously, there is some damage that can be done to your joint over time, having repetitive joint injections. But if you're delaying surgical intervention, which eventually we're going to be replacing portion or all of your joint, my approach to it is that as long as it's every 3 to 4 months with those injections, I don't do them any sooner than that. For the steroid injections, for the gel injections, it has to be every 6 months. But as long as you're tolerating the injections and they're giving you adequate improvement in your quality of life, then you can keep doing them, for the foreseeable future. Obviously understanding that it may be doing some micro trauma to the cartilage and to the knee joint. And it may, if you were going to be a candidate for a partial knee replacement, if enough damage happens to the cartilage, it could push you from a partial knee replacement into a total knee replacement. But my approach to it is very much, letting your symptoms, dictate when we do surgery.
Thank you. Someone asked, I had an ACL reconstruction, but tore the reconstructed ACL. I have lateral osteoarthritis. Without an ACL, does that mean I definitely need total knee replacement?
Well, so it depends on what's going on and happening in the other parts of your knee. And so if you have intact cartilage on the inside of your knee as well as underneath your kneecap, and you're not having any symptoms in those other parts of the knee, then you could be possibly a candidate for a partial knee replacement on the outside of your knee if the alignment is appropriate, and also based on your tunnel and tunnel positioning from your ACL reconstruction, that we'd have adequate bone structure to support the partial knee replacement.
Thank you. Someone else asked, I can live with the low to moderate pain, but would like to get my range of motion back. Right now, I can't lift my leg up to see the bottom of my foot. I walk about 12 to 15 miles a week and enjoy hiking. Is knee replacement the right thing I should be looking at in this situation?
So obviously part of that is a little bit, specific and hard to answer over a Facebook Live like this. Obviously, there are other parts that go into being able to see the bottom of your foot. So if it is somewhat a restriction in your hip motion, it could be that is also a component of this. So you may have some limitations in how flexible or how much motion your hip has. If you have significant limitation in the ability to just bend the knee itself, then that could be a indication for talking about a knee replacement. It probably would have to be a total knee replacement if you have that large of a restriction in your knee range of motion. But obviously it is a weighing of the risks and benefits. So if your pain is not that bad, going through a total knee replacement just for range of motion, you may still have some limitations in your range of motion after a total knee replacement. The best predictor of post-operative range of motion is preoperative range of motion. We can a lot of times very reliably get some improvement in range of motion, but it's not a guarantee that you're going to be getting 140 range of motion after a knee replacement, because there are patients who get a stiffness in their knee after a total knee replacement, a little bit higher than with a partial knee replacement.
Thank you. What kind of anesthesia is used?
So again, that is a surgeon individualized aspect, or at least a hospital or surgery center individualized answer. In our practice specifically, for a partial knee replacement is usually done either under general or spinal anesthesia, involving our anesthesia colleagues to help make that decision, and then usually do use some degree of a regional block around the knee with either what we call an adductor canal block or a popliteal block to help with some of the pain control. There also are some surgeons who do an intraoperative block around the knee with some pain medication to give you longer lasting relief in the post-operative setting.
Thank you. We've had a couple of people ask, how long after a partial knee replacement before you can start playing golf again?
Yeah. So for a partial knee replacement or total knee replacement, I do caution people from going back too soon, just because your bone will remodel. Now, there's sort of two different ways we can fix a total knee replacement, and there's newer techniques coming out with a partial knee replacement where actually your bone grows into the implant. That takes anywhere from 6 to 12 weeks to happen. And so don't want stressing too much during that time frame while that bone is growing in. The biggest stress that we'd be concerned about would be that rotation with twisting for golf. The same thing though with a cemented partial or total knee replacement is that your body will be stress remodeling around those new cuts for putting that implant in. And so we want to give it time to sort of heal and remodel around those little micro cracks and fractures that happen from making the surgery. And so I do caution people from that heavy impact for 3 months, as well as the heavy twisting. So that would preclude playing, 18 holes of golf. I do tell people that they can start getting back to putting and chipping earlier, and that's a little bit earlier with the partial knee replacement, but then restrain them from playing a full round of golf or really going out to the driving range for that first 3 months.
Thank you. Are there BMI limits on a partial knee replacement?
Yeah. So every office again has their own answers about this as well. At OrthoVirginia, we have adopted some of the data out there with optimization of patients. So we optimize on multiple different fronts. So one is just making sure you're safe from a medical standpoint, getting you to see your medical doctor or see a medical provider to give you clearance. If you have known medical comorbidities, diabetes needs to be well controlled, pulmonary disease needs to be well controlled, your nutrition needs to be up to a certain standard, and then BMI does come into that. So they've done some studies out there looking at it. For patients with a BMI greater than 40, you're anywhere from a 6 to a 20 time increased risk for a complication. And so obviously we want to try to minimize those complications. So at our group at OrthoVirginia, we have instituted a BMI cutoff of 40 for surgical intervention for a partial or a total knee replacement. And so that would be our cutoff for those procedures. Like I said previously, there were some people who used to do a cutoff of 30 for a partial knee replacement. In my practice, as well as many of my partners, we do not hold that level anymore. But there may be other doctors out there that you would go to see that would say 30 or 35 for their BMI cutoff. But for our group, our joint replacement BMI cutoff is 40, and we've got different avenues and methods to help you get that BMI down to make you the safest patient possible for having the surgery.
All right, thank you. Any questions that we were unable to get to today due to time, we will answer in the comments on the video. Dr. Robertson, if you would like to close.
Everyone, thank you so much for coming out and listening to our Facebook Live. Obviously, we're here to try to help the community understand knee pain and knee arthritis, as well as then provide treatment with surgery. If you would like to inquire more about your knee pain or inquire about surgery, please reach out to us at orthovirginia.com. And we have the ability to do online booking and scheduling there. And we otherwise look forward to helping with this as well as other orthopedic issues in the future. Thanks so much for your time.